What about people who have survived a heart attack, Dr. Thompson? What should they do to prevent another one?
Well, there's a lot they should do, and the first thing they should do is pay attention to their bodies and pay attention to what's available for them to learn. You know, in the end, we can go to doctors, we can talk to pharmacists, nutritionists, trainers, all kinds of people, but in the end, it's really up to us. And I think you know I've had 3 heart attacks.
3.
And you really have to pay attention. If you have a heart attack, you are at greater risk to have a second, and in my case, a third. So you really need to pay attention at trying to modify your life to lower your risk factors. The other thing that you have to really pay attention to is what are the signs of heart disease and heart attacks. You know, when I had my first heart attack, I didn't know. I thought I was having, and I'm a doctor, I thought, I wonder if I'm having indigestion or heartburn. And I finally said to myself, I had read a book by a cardiologist called Stress Without Distress. And when he was having his heart attack, he was rationalizing in his mind why he wasn't having a heart attack. And he said in his book something to the effect, he decided he could either take action or ignore it and probably be a fool. So he told his secretary, and he obviously survived to write his book. Well, I was with my family and some friends, and I was experiencing this, and I finally told my friend, I said, I think we better go to the hospital. And I had a cardiac arrest within less than 2 minutes, probably within a minute of getting on the ER gurney. And if I delayed it anymore, I wouldn't be here. And so I think take action is what you need to do that. And then obviously after that, when I survived the acute event, and anyone who has a heart attack, you survive it, you get pretty thoughtful and pretty reflective about what you can do. And you need to do that. You really need to make change in your life. You need to look at how you're living your life in regards to diet, exercise, your nutritional intake, a lot of things, and take inventory, get some good advice, read a lot, and then make changes.
Well, let me ask you, do you worry about it? Like, this could happen to me again at any
time? Certainly I do, especially when I had the second and the third. You know, we're all human beings. It's human nature to think we're invincible. One of our earlier talks, you said men do that more than women, and you are right. And you don't think it's going to happen again, or you think, well, I've done all these things, I should be okay. But if you've had one, you're at higher risk for the next one. So if you get symptoms, in my second one, I really had very minimal symptoms.
You did?
But I did have a little bit of unexplained pressure in my chest. And I said, you know what, you better check this out. And I went to the emergency room, I called 911, the ambulance came. I cannot overemphasize the importance of utilizing the emergency medical system in this country. In 2 of my 3 heart attacks, I got there because of the EMS personnel, and it was literally life-saving. But anyway, once, you know, Raina, I got to the emergency room, the EKG looked okay, my symptoms were already going away, and everybody thought, the cardiologist thought, well, we'll do the formality of the blood test, but you'll probably go home. And when he walked up to me about 15 minutes later, he had a pretty serious look on his face, and I knew then that I'd had another heart attack. And by that time, my symptoms were gone, the damage was done, and so it was that was prior to the newer clot buster drugs, which actually saved my life the 3rd time. But the 2nd time, I did not have very intense symptoms, but fortunately, I did go in and I got it checked, yes. So I would advise people, if they've had one, be even more vigilant about paying attention to any potential symptoms.
Be vigilant without being paranoid.
Correct, correct.
Thank
Well
you.
said, well said.
Thank you, Dr. Thompson.